Yeah, I mean, digital health is a very crowded space. We've had quite a lot of good fortune over the past couple of years. About 2 years ago, we made a global partnership with Apple. Tim Cook, the CEO, actually mentioned us in his earnings call about one of the projects that we have at one of his hospitals. We've also had the fortune of joining our Prime Minister, Theresa May, on her state visit to China, where we announced a lot of trade deals and partnerships. And we've recently expanded into the US, where we recently acquired a company. And I think now we've kind of got the firepower to be able to speak publicly about our longer-term vision and aspirations, wherein realizing that patients typically suffering from chronic diseases usually have a complication because of the adverse events associated with the disease, not the disease itself. So if we can somehow bridge a connection between doctors and their patients through a software platform, have a data stream feeding between these individuals, we can perhaps mitigate these complications before they arise. So what we've built in partnership with Apple is basically a collection of different modules that a clinician can configure according to certain care pathways that help them better understand their patients. So it could be things like helping a patient understand when to take their medicine, or it could be what we call an active task, something you would typically have only done in a hospital setting, you can now do at home remotely, and then giving a patient a dashboard to be able to see this information and engage with their health. Similarly, all this data is streamed to the clinician's portal, giving them a good understanding of risk stratification across these cohorts. The software platform itself is device agnostic. We've integrated to a host of different wearable devices. Data can come passively into the provider end. You can choose from about 100 different modules that we have now built, so catering exactly which data points to which diseases you want to see. And then on the other side of the equation, we can actually deliver a lot of educational content to these patients, help them better understand their condition. So we've now grown to this point where we can cover a number of different diseases. We've got care plans for about 30 different indications so far. The focus has really always been around rare diseases and chronic diseases. But I guess given the modular nature of our platform, it's found use cases in other different industry verticals entirely. We started our journey here in London at the NHS. We then started working with private providers as well, university partnerships. Then pharmaceutical companies started realizing some value in the data for real-world evidence, real-world data, helping them understand the efficacy and improve outcomes with their products in the real world. And then this has taken us to relationships with governments and also sports teams that use our solution. When we first started, when we spun out about 7 years ago from Oxford University, we started going to the hospitals. It took a long time to get to where we are now, and people looked at us as no more than just gadgets or gizmos. We never thought that we'd realize this sort of landmark achievement of being recognized as a standard of care. So meaning that any patient presenting to the NHS with this rare disorder here, splanchnic venous thrombosis, also at Hospitals Corporation of America, rare pediatric brain cancer, any patient with these diseases will have to use Medopad as part of that care plan. So we've gradually grown the business and won a lot of contracts and projects with different hospitals. And quite amazingly, in the past 6 months, either directly or indirectly through our partners, we've won an additional 600 hospital projects. Now what we've started doing is actually adding some intelligence. We've been collecting very unique data that we define with key opinion leaders to be informative around disease progression. How do we use this data to predict and prevent complications and deliver on our vision? So what we've got here is something we presented at the International Congress for Parkinson's and Movement Disorders in Hong Kong a couple of weeks ago. And we've actually started digitizing, creating digital biomarkers for disease progression. So now you no longer need to go to your clinic, this is for Parkinson's, to do this UPDRS, different scores. You can actually do them from home. Your caregiver can take a video and your doctor can get a very good assessment of how you're doing. So I think by adding more intelligence to our disease deployments, further expanding our reach and bringing together and consolidating this ecosystem of partners we're establishing, we can help deliver on our vision to help extend life expectancy. Thank you.